Welcome back to the show. Parents and grandparents, listen up. Do you know the difference between red eye and pink eye? Well, they're actually two very different conditions and, of course, require very different treatment. And here to explain is optometrist Dr. Gina. Wesley, welcome back, Dr. G.
Thank you.
I was telling you, my daughter gets a little redness in her eyes sometimes, and every parent who's getting ready to send their kid off to school that morning thinks, is it pink eye? It's highly contagious. Maybe she shouldn't go. Tell me the difference in this red eye and pink eye thing.
Well, the thing to remember is anytime somebody has a red, irritated, or watery eye, there can be a lot of different things that could be going on, especially if you involve contact lens wear into that. A true pink eye that you hear about that's very contagious is usually related to a cold or an upper respiratory infection that has then spread to the eyes. A red eye can be a number of different things, including a bacterial infection or allergies or contact lens overwear. So it's just important that people get properly checked out so they know what's going on.
What is the problem with self-diagnosing? I mean, I'm kind of standing there like every other parent looking in my kid's eyes. What kind of damage can we do by not looking at the right things?
Well, you can actually do a lot of damage because if you improperly guess as to what's going on with the eyes and you try to treat it and it doesn't get better, it could actually be a serious infection that can cause permanent damage to the eye, such as corneal scarring or really bad internal inflammation inside the eye that can really damage the retina and other structures of the eye that are very important for normal vision.
We've got a little animation, I think, in what's going on in your eye, whether it's red eye or pink eye or whatever. What is this?
Right, so they're just showing you kind of some common symptoms and signs that you may have. You can see that the white part of the eye is starting to get really red and irritated, and it's starting to get kind of watery. And this can indicate a bunch of different issues or problems. It could be an infection, it could be a scratch on the cornea, it could be allergies. People often misdiagnose themselves as having an infection when actually they have allergy issues that are making their eyes itchy and very much may imitate an eye infection. Now they're showing here possible internal inflammation and problems that can imitate eye infections. Even things like glaucoma can imitate a really bad eye inflammation or infection. So it's just important that you go to an eye doctor who has the proper equipment to determine, well, why is my vision getting blurry? Why is my eye red and irritated? Because the earlier the treatment, the faster you're going to heal up and the less risk there is to damaging your vision.
Let's talk treatment, because when do we, as parents, if we ran to the doctor every time the kid had a little something wrong with him, we'd be at a doctor's office all the time. Usually our first line of attack is the drugstore. I see a lot of products here.
Right.
What are these products about?
You know, I'm just showing here, this is just a small sample of the plethora of eye drops that are out there and why it's so confusing to go to the drugstore and try and figure out, hey, what drop should I use for what problem do I have? And oftentimes people pick the wrong eye drop.
Do we talk to the pharmacist? Does he know?
The pharmacist might be able to help you out, but only if you know what's wrong with the eye.
So when do we go to the doctor?
You know,
1 day, 2 days? What do you think?
As soon as you possibly can. If that eye is red and irritated and it's lasting for more than a day, you should get in and see what's going on so that you can protect your eyes and your vision. Because vision really is, you know, one of the most important senses that we have as humans, and people really don't want anything to go wrong with it. So it's something we shouldn't take for granted and should get properly checked out.
Right. Well, great information as always. Nice to see you again.
Thanks for
And for more information on Dr. Gina Wesley and any of the things that we talked about, you can visit showcaseminnesota.com and just click on the Tuesday link.